my name is Stevenson Bulgarian, and in this validation I will be going over changing a wet to dry dressing while performing sterile technique. First thing I'm going to do is come in, introduce myself, close the actual curtains or door for patient privacy, wash my hands, and identify the patient with 2 forms of ID, either by asking first and last name and the date of birth. Also explain to the patient what I am doing, which is going to be changing their dressing. So first thing I'm going to do is close the bed up.
Make sure that the patient
Forcing the pipe. Do that. I'm also going to check the patient's ID, first and last name, date of birth. All right. So what I'm going to do is also move this down so it doesn't actually interrupt my sterile field. So I'm going to prep the sterile field. New packaging. Make sure you inspect for any actual deterioration of the packaging, expiration date, all that stuff. So you're going to grab the top of it, push it down, it opens up. And just keep going down over it. So I'm going to place this down. I'm going to do is grab the corners as little as possible. Open it up. Make sure nothing is touching the actual. I'm going to remove the trash. I'm going to gently drape over my working area. Alright, so I'm going to get that.
Can I use your room when you're done?
Next I am going to actually get my basin. I'm going to open it as careful as possible, not touching the actual plastic part as I expose. So keep opening it up. As little as possible. I'm going to place it right here. Discard the trash. Also for trash, you can use a moisture-proof bag. Just have like a little cup over it, just to make sure. Next, I'm going to actually pour some of the solution into the basin. So, usually, if it's not a brand new container, you would actually lift some over trash, making sure nothing is present. Also covering the label as you pour it. So open it, cover it, pour some in there, back up, place this on the side, you don't need it. Next, I am going to open up some of this actual gauze and the ABDB pad onto the actual sterile field. Some of the ones that are going to be wet, I'm actually going to open individually into the actual. Make sure, just drop them over in there. Discard. Going to place about 4 into the actual basin. There. And the last one. In there. It's wet. Also with this guy, you just want to place some extra ones here so I can actually use. So I'm just going to place them down here. Discard. Last thing is my ABDB pad. So open this up the same way I opened up every new packaging. Make sure I open it over the sterile field. Just drops. actually going to assess the actual wound. First thing I'm going to do is wash my hands again and put on clean gloves.
Seven steps?
7 lights?
When you write them, 7 steps.
On gloves, adjust it once you have both gloves on.
생각보다 뭔지 몰라가지고. 7 steps.
Adjust this guy. So you're going to come over to the patient, expose the wound. You're going to not expose too much, just so you can give the patient some privacy. So you're going to see the wound there. You're going to assess it to see if there's any irritation, different kind of drainage, but before that, you're going to remove the tape. You're going to be careful on removing the tape so you don't actually pull the skin. So as you're doing it, hold down the skin, remove the tape,
You check your medication 3 times
tape,
before, after, and then right
tape,
before you.
tape, and from the top to bottom, remove the old dressing, making sure you remove everything there. If there's anything packed in there, just gently try to get it out. Get it out, and discard it in the trash. Okay, so now you're going to discard these gloves as well. Trash. Wash your hands again. Now you're going to put your sterile gloves on. Since we're limited with actual tables, my sterile gloves are over here. Be a brand new packaging. Go and open them up. Make sure I can touch this side in. I can move this aside. So what I'm going to do, place them down, facing me, right here, left here. Bring these guys up. And up. And when you're opening the actual gloves, make sure you grab the inside here, so you're not touching the gloves themselves. We're going to open them up, lay flat, so you're ready to put the gloves on. You're going to grab, with your non-dominant hand, the cuff of your right, and you're going to slide in. Okay, this is fine. You're not going to touch any of this. For now, just leave that. Then, next glove.
I'm gonna do this.
Same thing.
I think I did.
As you're doing this, lift up.
Okay.
Keep touching the inside of the cuff.
Highlights.
Place. Make sure they're comfortable.
Instead of the sterile field.
Alright, so now we are going to actually clean the wound.
There's some check.
So,
Close the curtain for
you're in front of your sterile field. You grab with your non-dominant hand.
and raise the back towards the
Wet gauze. You're going to rinse so it's not dripping wet. And you're going to transfer it to your dominant hand, which will do the procedure. Make sure your gloves are not touching. You're just touching the gauze. And when you go to clean, you're going to make sure you are cleaning from farthest away first. So in a downward motion, clean down, discard, grab your second gauze, do the same thing, make sure it's not dripping wet, transfer it to your dominant hand,
Videoing.
the middle
You
part,
can go. Your attendance today is that I
Down.
get the video by 5 o'clock. If I
discard,
have the video, then you're
and
if I
then
don't get the
you
video
do the
today.
closest one to you again.
Yeah.
So, rinse off, it's not soaking wet, transfer back, down, and then discard. Last, you're going to place a little bit of a wet gauze. Again, rinse it, make sure it's not dripping wet, and you're going to transfer it to your dominant hand. Place it down there, make sure it's on the wound area, and then with a dry one,
Make sure
going to
everything is
cover
in the way.
the
Make
actual
sure the mannequins are in the beds, the
wet
sheets are
one.
straight
So
over.
same technique,
the way.
you're gonna transfer over, place it on there gently, and with your baby DB pad, you're going to cover that as well. So if you're due, just grab it, same technique, transfer it, Make sure the blue line is on top.
Do this. Look into this.
I'm going to place it right over the patient. You're also going to tape, usually kind of like a picture frame technique. So starting on the top, across, then down, on the bottom as well, and here. So with that done, what we're going to do is cover the patient back up.
Assess the patient's wounded.
Also discard of the gloves, same technique as the other gloves. Take them off here. Put them in the trash. Before you do that as well, you want to make sure you write your name, initials, time and date when you clean the actual and change the actual dressing. Assess the patient, see if there are any pain or discomfort. I'm going to put the actual side rail back up. Pulling the patient back down. Discard of everything else that you've used. Also, in the patient's chart, note any actual changes in the dressing, if there was any discharge or color irritation. Make sure you actually document that. Close the patient's chart. Reassess the patient again just to make sure, and you are done with the procedure.